Welcome to Dr. Cherie's podcast. Today I have my favorite guest and my weekly guest, Shiri Benarzi, and I'm welcoming you back to watching our latest podcast. Today's going to be really interesting and maybe a little bit feisty. Don't tune it out because you can share this with people and really start lively conversations. So join me in welcoming. Hi, Shiri. How are you today?
I am well and a little bit feisty, so yeah.
Oh, great. Okay. So how's the coronavirus treating you and your world today on the 1st of May?
Well, it seems in my corner of the world, the government is starting to discuss with the Ministry of Education, how will they go about opening schools again? It seemed that they didn't bother to do that until now.
Mm-hmm.
So we don't know what's going to happen, if it's going to happen, when it's going to happen. It is going to happen at some point. We have seen demonstrations every day of the week by different sectors. Basically people, mostly middle class, entrepreneurs, small businesses, absolutely collapsing. Teachers being asked to volunteer throughout their summer vacation to teach. What's that about? Our healthcare heroes are not being paid enough, so it's nice, to clap hands and send them roses, but for God's sake, pay them a decent salary. So, it just seems like things have been being managed in a weird way. It's not all bad, but a lot of questions that need to be asked are not being asked.
So let's start with what questions we, all of us, should be asking. What are the critical questions that should be asked that either we're not asking because we're not courageous enough, or we're not asking because we're not thinking about them, or we're not asking them because we're being naive and putting our heads in the sand and thinking everybody's fine and we're being taken care of?
Well, I think let's look at it globally and not locally, okay? Because on a local level, there are additional set of questions that are relevant for your country, your leadership, your politics, your economy, and your life. But on a global level, there are a lot of questions that I think we're not asking, and if they're being asked, they're also being shushed. So I'm not a doctor, okay?
But you
However,
But you know a lot about medicine.
I do.
You would not prescribe people taking Clorox or Lysol as a preventative or a cure for the coronavirus.
No, I won't. I wouldn't prescribe anything other than common sense.
Yes.
Seriously.
There's a real dearth of common sense these days. So go ahead, globally.
So globally, okay, so we quarantined for a month. Usually looking back, throughout history, when there was a pandemic, the sick people used to be quarantined and not the healthy people. So I'm saying, okay, we went about this the other way. Isn't it time that we stopped and reevaluated? Mm-hmm. So I'm looking at Israel, where I live. I'm looking at the US because it's in the news. I'm looking at other countries. And I'm also looking at Europe, and I'm looking at Norway and Sweden that bravely decided to do their own thing. And both countries actually have a physician running the Ministry of Health.
What a concept.
God, what a concept. And they decided to go about it another way. And you know what? Looking at the statistics so far, because statistics are changing all the time, okay? So I'm going to say, looking at the statistics so far, I don't see that big of a gap. So if that's the case, isn't it time that we reevaluate? What are we attached to exactly? Other than saving lives, okay? What are we attaching ourselves to? What concepts? Do we need to continue quarantining like this? What is the price that we're paying for it? I mean, the financial price is, I don't think we're able to estimate, fully what's that going to cost and how long it's going to take to rebuild. So I'm looking at that. And then, I'm looking at the whole vaccine thing. I'm not anti-vaccine. What I am is a very aware and empowered health consumer. So first of all, let's take the idea of being an empowered consumer, because we are, most of us, empowered consumers, or we strive to be. When we go and buy a property or some kind of a product or whatever it is, we have an agenda of doing research and being empowered and asking questions and looking at this as a product, okay? Why don't we do the same when we're consuming health services? That's a product as well.
Right.
Okay, so let's look at vaccines. So there is this guy with a lot of money, okay, and all of a sudden is pushing vaccines. He wasn't in the vaccine business until quite recently, from what I know. And I'm asking, what's the agenda here? You don't push vaccines, you don't push any medication. There is a process. There is a reason why the FDA exists. There is a reason why it takes time to release a new medication, new therapy. There is a reason why it doesn't take 3 months to release a vaccine, but it usually takes somewhere between 2 years or 3 years to release a new vaccine. So why are we pushing this one? Look at the death rates, okay? Corona is dangerous. I'm in a risk group. Listen, it's dangerous for me, okay, because I'm living with a heart and lung condition. But you know what? If we look at the death rate from the flu every year, it's way higher.
So far.
So I think,
but it could get worse.
It could get worse. I'm not a prophet. It could get worse. But you know what? We're not quarantining every winter when there's a flu. Okay, we kind of take that one casually, and we shouldn't, by the way, because the flu is very dangerous. So we're all wrapped up around this corona. There is a reason, okay? There's always a 2% truth here. But it just feels like the hysteria is just spreading like wildfire. Come on, let's take a breath. Let's pause and reassess. There was a policy so far, okay? Like any project management, like any company, like any society, let's reevaluate what worked, what's not working, what needs to go out the window and be replaced, and what needs to be updated. But let's start holding our leadership accountable. We can't just run wild with this.
Okay,
sorry?
I want to play devil's advocate for a moment. And it's about the flu, particularly. Now, I have not been a big vaccine person. As a matter of fact, I can't remember when I was vaccinated because I basically don't believe in them. I may change that point of view now, but I haven't in the past. I haven't wanted to get vaccinated with some sort of serum that's going to give me a mild case of whatever the big case is. So I'll avoid the big case. But to me, and my understanding of this, and I'm not a medical doctor either, but my understanding of the difference between the flu is that in the flu situation, people have symptoms. And when you come in contact with somebody who has symptoms, then you can get the flu. But there are symptoms that send out a warning signal, I'm sick. And with this coronavirus, to the best of my knowledge, the asymptomatic people can be walking around feeling absolutely fine and dandy as a carrier. And they can be carrying that to an unlimited number of people with no knowledge of it. And that's the reason for the quarantining, is because we don't know who has it, who doesn't have it. We never had enough tests to be able to find out who did and didn't have it. And if you tested negative today, you could test positive tomorrow. So it's kind of like this big house of cards that nobody really understands how to be able to sort out who has it, who doesn't have it. Why do these people have it and those people don't, especially when they're husbands and wives on a cruise ship quarantined in the same cabin, and he gets it, she doesn't, or she gets it, he doesn't. We can't seem to figure those things out, and that's very different from the flu, I think.
Well, the flu is a very general name for a bunch of viruses, okay? And they have different incubation times, okay? But I'm just saying, I'm not saying the corona is the flu, okay? And I'm not comparing, I'm just saying, listen, we also, every winter, okay, we have the seasonal bunch of viruses, okay, that have a higher death rate than corona. Now, we don't know if corona is seasonal yet. And yes, it has this incubation time, which people seem to be asymptomatic. We still don't know what's happening with children. Are they carriers, asymptomatic carriers? Are they not? There's a lot that we don't know.
Right.
So how about we start really actively looking into that? Now, I've been hearing different doctors in the ER, saying that, there's something odd about the corona because the infection seems to be on both lungs and not one lung, and it seems like hypoxia. Let's listen to those voices. That's all I'm saying. Let's listen to those voices. Let's take that into consideration. Let's expand the research. Let's do more testing. Come on, it's been a month. It's time to really do more testing by now. I get the reaction that was at the beginning. There was so much that wasn't known, so people went to the extreme and said, okay, total shutdown, okay? I get it. I don't necessarily agree with it, but I get it. But now, a month and more after that, come on, we need to reevaluate. We need to start gathering data more actively so that we can make, smarter decisions later on. We need to look into different things that correspond, okay?
So what are the questions? What are the questions we should be asking?
First of all, we should be asking about vaccines, okay? Are they safe? Were they tested properly? I'm not saying no to vaccines. I'm just saying be a smart consumer. Every 7 years, I take a vaccine against pneumonia. I don't take flu vaccines, okay? I have my research. I have information. I've did my research. This is right for me, period. Okay? Please do the same. Find out what's right for you.
How do you do that? You're more savvy, you're more connected to the health community. The average person who's listening to this today, what are the kinds of questions that they should be asking, and who should they be asking them of?
Well, they should be asking their doctor. They should, and I invite people to go online and look for the research. Go, there's a lot of data that's online that's not conspiracy and fringe data. You find this on, the FDA side, you find it on the clinical trial side, things that are approved, things that are documented properly. You also need to know the clinical tests you need to take with a pinch of salt. You need to know how to read them. But when you're getting a vaccine, how long has this vaccine been out there? Okay, is it still being tested? Am I being tested on? Okay, ask that. Okay, what is the data? What are the statistics? What does this vaccine include? Does it include heavy metals in it? Some vaccines do. Do you know that the body doesn't process that? Okay, does this vaccine include a weakened virus or a virus that's dead? Okay, ask the questions. What exactly is being put into your body? What should you expect? Many times a vaccine will trigger the immune system.
You are, and I'm not saying this because I want you to be my friend, you are a very intelligent, you are very savvy, you're very well connected, and you're also an academic. And so you would be comfortable researching data online. Now, you are unique in a lot of ways, and a lot of people are not necessarily comfortable researching data that they're not going to be able to find, and if they find it, they wouldn't understand it anyway, and they don't really know. There are some nice explanations of what a virus is versus a bacteria these days, but knowing what questions one would ask and how one would go about it, maybe people are afraid to know the truth.
You know what? I respect that. I respect that because the truth can be frightening. Because one of the things, and you know what? One thing that I invite you to do is that when you feel that you've been bombarded with the truth and that has been facilitated to you in a way that you cannot possibly understand, please don't be shy and ask to be explained as if you were a 5-year-old, because this is what I did at the beginning. When I was bombarded with medical terminology and I was like, whoa, okay, I don't understand. I'm not an MD, okay, do whatever you want. Hell no. You explain this to me so I do understand. Explain this to me in layman terms as if I were a 10-year-old or a 5-year-old. I need to understand. It's my basic human right to understand. Demand that right. Don't be intimidated by professional terminology. Okay?
I think it's easy to be intimidated by anybody who speaks in a jargon that we don't understand, a terminology that is either in Latin or way over our heads. And
that's part of the manipulation. That's part of the manipulation. Recognize it's just, you know what? One of the best ways to scare someone into not asking any more questions.
Yeah, intimidate
Is
them.
talk to them as if they were stupid, okay, and bombard them with professional terminology that they have, preferably in a foreign language if you can, so they don't understand. And then they go like, okay, well, okay, fine, whatever.
So I remember when somebody said to me, we have to aggregate the algorithm.
No, okay.
Oh crap, I have no idea what that is. Do I admit it, or do I look glassy-eyed, or do I run to the Google and look it up? Because I don't know what they're talking about. And this wasn't obviously technology, but I think it could happen in almost any field where somebody uses words that are not your common phrases that intimidate the person and have them basically shut down.
So I have this thing with my doctor, my cardiologist, whom I love dearly, because he simply collaborates with me. Like, he gets it. So when he starts talking in language that I don't understand, and after living 20 years with a chronic illness, there's a lot that I do understand, okay? So there are two things that I say. I say, okay, now in Hebrew, and draw me a picture.
Now,
I'm going to do this until I do understand.
did you train him?
Yes, I did.
Well, then I rest my case.
Listen, he's been with me for a few years, so it's a relationship,
So if we could send all of these physicians to you to train, it would be a totally different world.
Bring him on. Just
Bring
bring
him
him on. So ask about food. Okay, what can you do in terms of food? Organic, non-organic. Now, by the way, understand what organic means, okay? Because some things are organic by nature and they don't need, the label that, doubles the price.
Right.
Okay. So what can you do in terms of food to strengthen your immune system? How about food supplements? Now, this is a crazy market, okay? Crazy. It's not regulated. There's a lot of fake news. Should I use that term?
Say, conjecture, assumptions, and quackery. I don't know. But don't use fake news, please.
Okay. There are a lot of variations on snake oil, okay, in this field. But some things are true. So instead of asking about food supplements, ask about vitamins.
Okay.
Ask about minerals. Okay? Don't ask about labels and don't ask about combinations. Make it simple. So vitamin C, vitamin D, does it help? How much? And sometimes you can overdose on vitamins. Know that. That's just because it comes from nature doesn't mean it's not toxic. Doesn't mean it can be abused. It cannot be abused. It can. There is such a thing as taking too many vitamins or overdosing and creating damage. So who should you ask? Some kind of health practitioner that is practicing integrative medicine, not alternative, but integrative, because integrative medicine usually the people you'll find in this field are MDs, meaning they've been raised and trained in the traditional Western methodologies, and in addition they have knowledge in other fields of medicine and they integrate it. These are people with a lot of knowledge and a holistic point of view, meaning they look at the whole picture. They have a meta view. They can see the details, but they can also see the big pictures. So go and ask someone like this. Okay.
Now, you were saying something before that really interested me. And you said, when we were talking before our program, somebody is profiting from this.
Yes. Somebody's always profiting. Always.
Okay, so I'm sure that Zoom is profiting. I'm sure that
I don't have a problem with Zoom profiting.
The toilet paper companies are profiting. People who make masks are probably profiting. Ventilators, I guess. But I think you were talking about something other than that.
Okay. Listen, I come from a part of the world where in order to survive, you have to be a little bit cynical and you have to look for the angle. Okay. So, okay. So who's about to screw me? Pardon my language. And I also live in an area which has been for many years a conflict zone to one degree or another.
Mm-hmm.
So every time I see a war around the world, I ask myself, okay, who's making money off this? Someone is always making money off this. Now, you know, the weapon industry, you know, not just guns, but weapons in
Right.
general,
Of mass destruction.
Mass destruction, you know, army weapons and stuff like that. That is one of the most profitable industries in the world.
Yeah.
And so is the pharmaceutical industry. Now, I love the pharmaceutical industry. I have my agenda with them. I don't always like what they do, and I don't always like how they do it. Okay. But it is important to do research and create medication. And like any other industry, whenever there's money involved, big money, there's also power involved. And that's where people go corrupt. So you see corruption in every possible industry, everywhere. Okay? I'm not talking about that. I'm trying to ask myself, okay, so we went into global shutdown. Who's profiting from this? Okay? I'm not sure it's about profiting from the actual shutdown, that it is profiting from the rebuilding after that. So now that we are slowly shifting into a phase of starting to rebuild and trying to assess, you know, how is the day after going to look like, I am looking for the big forces, the big money. Now, there's money in medication, there's money in equipment, there's money in data. So who's profiting? I don't have all the answers. But you know what? I'm going to keep asking this question. I noticed that, you know, while we were all busy in survival mode dealing with this horrible pandemic, in many countries, a lot of laws were kind of passed under the radar that had to do with civil rights, that had to do with access to data. Okay. In Israel, they tried to pass a law that will allow the government to basically monitor all the citizens by forcing them to have this software on their phone. Really? Really? Corona is not an excuse. Not ever. Okay? All of a sudden, we have all these things like in terms of infrastructure. Okay? Like the 5G. Now, believe what you want about this. We need to ask the questions. If this is in fact a conspiracy theory, then it's not going to hold water, okay? It's just going to dissolve. It's going to be bullshit. But maybe it's not. We won't know until we ask.
So what are the questions we should be asking about the 5G?
Why is the technology being pushed now? Is there any connection between the fact that this has been pushed now and the corona? I don't know. Maybe the connection isn't a direct connection. Maybe it's an indirect connection. Maybe we know that our body is reacting to radiation. Okay? We know that our body is reacting to these kind of frequencies. The 5G technology is different from what we've known so far. It hasn't been researched enough. Do we really know how this affects our mitochondria in the body, in our cells? Do we really know how this affects our immune system? I don't think we've done enough research. So I'm not crying out conspiracy. I'm actually crying out stupidity. Seriously, stop for a second. Okay, maybe 5G is the best thing since sliced bread. Maybe it's not. We have no idea. And maybe the connection between the 5G and the corona is the fact that 5G is actually weakening our immune system. So then when a virus comes along, it becomes a pandemic because a lot of people have a compromised immune system or weaker than normal. I don't know. I'm just saying, can we please ask these questions? Why is YouTube banning videos, conspiracy videos that have to do with the connection between 5G and corona? I saw this ad on YouTube. I'm like, seriously? Who are you to ban information? If it has nothing to it, then it has nothing to it. How will we know if it has nothing to it? We need to look into it.
So I don't know if you heard about China. They now have a thing where every citizen has to have a QR code, which has their information on it. So I think that's also maybe what you're talking about is a way for government to become more big brother than ever before.
You know, it's easiest to rule people when they're scared. They'll do anything. They will comply, you know, to almost anything. That's so easy. So again, going back to the question, who's profiting? That's one way of profiting. If you can bring an entire population to a point where they agree to that, oh my God, you're profiting big time.
So whoever makes the QR codes would be profiting in China then.
Of course. And then there's so much data, and that data is translated into money. Come on, data is power. People that have big data, organizations that have big data, they have a lot of power. So let's just be aware of that.
Okay, so let's leave people with a few call to action steps that they can take if they're willing to cross the line called becoming informed as opposed to being a fearful child.
Okay, so first of all, let's agree that a crisis is not a good enough excuse to give up your human rights, your civil rights. Right. Okay, let's agree to that. Okay, and if you are giving them up, make sure that it's for a short period of time and that you have some kind of reassurance that, you know, those rights will be given back to you. I don't know how to do that, okay? I don't know if that's even doable, okay? Because once you give them up, by the way.
Exactly. It's like, I gave them up, I can't get them back now.
Exactly. So what I'm saying is start putting question marks. The best thing I can offer you is the frame, is that so? Notice what comes up for you. First of all, for you, okay? Because when you're sitting in front of the news, okay, and you see this leader, another leader, someone recommending, I don't know, injecting some form of bleach, ask yourself, I don't know who that is, okay? Or someone, I don't know, all of a sudden saying, listen, we have to come together. This is an emergency. And so we need you to do 1, 2, 3, 4 as a good citizen. So, is that so? See what comes up in you. Yeah. First of all, if there's the slightest, like 2% of discomfort, please listen to that discomfort and respect it.
Nice.
Okay? This just means that you need more information. That's all it means. So ask for that information until you are comfortable enough to comply.
So you're saying ask, ask, ask. And don't sit in intimidation or fear or in belittlement. Ask, find out, and then check in with yourself and see if that's accurate and how it feels inside.
Yeah. And when someone says or gives you a feeling that they know better than you, it's like, you know, I know better. Let me make this decision for you. Is that so? Never trust someone that knows better than you what's good for you. Never, ever, ever as a default, unless they have proven themselves, you know, way and beyond.
Said like a true coach.
Yeah.
I love that. Okay, so listen to your own instincts. Ask questions. Don't just take information at face value because somebody speaks with a loud, gruff voice and sounds intimidating. And
a lot of foreign terminology.
And what?
Foreign terminology.
Yeah, exactly. And keep asking as a curious 5-year-old who wants information, not only explained, but maybe drawn out, but in such a way that you can understand. And stand up for your rights. Don't give them away.
Yeah. And one more thing. Listen to uncomfortable opinions. Okay? All those people with the conspiracy theories that are, you know, saying really uncomfortable things, listen to them. Okay? Just so you know what they're talking about. And then see how you feel about that. Okay? And maybe you feel uncomfortable because the possibility that they might be right or they might be 30% right is so frightening that you can barely breathe. Then you might have your answer. Okay?
Right. Okay. So to our listeners, guests, and viewers, ask questions. Trust yourself. Push the envelope. Don't let people intimidate you. Stand up for your rights. And don't let fear overcome you and dictate your reality, because as Shiri said so well, once you get people afraid, you can control them. You don't need to be controlled. You have control of your own life.
And you can condition them. And none of us want to be conditioned.
So join us again for our next podcast on the Dr. Cherie Show. And thank you for joining us today. Don't forget that Shiri is starting her next medical coach training program on the
1st of June.
1st of June.
Yes.
So don't miss it. This is important. If you are a coach and you're watching this and medical coaching has ever resonated with you, get on it. Find out more. She's on Facebook. She's on all kinds of social media. Don't let it pass you by. This is really important. She's a brilliant woman. If you want to do this, learn from her. She's the best. And if you're interested in taking a coach training, either a 60-hour or 125-hour, or you want to get hours towards your MCC, we have a training that is starting on June 2nd, day after. And get a hold of us. We'll give you all the information you need. You can make an informed choice. You can ask us, and we will answer in English, in plain English. Thanks for watching. Join us again next time. Bye.
Bye-bye.